Good morning, good morning, good morning, great leaders. Good morning. It's about that time. Let me just connect as well. Let me just connect. Okay. Good morning, great leaders. Good morning. Happy Monday, 18th of July, which happens to be Nelson Mandela Day. Let's just check. Okay. So you can hear me. I'm audible. Perfect. Good morning, great leaders. Shout, 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 shout. Who's here? Who's in training? Who is in tonight's training? We are talking about constipation. Please say hello, shout. Let's hear where you're from, where are you connecting from. And before we start with training, can we please also share our this link with our respective partners, whoever that might be, with your prospects maybe, because constipation is, yeah, no, it's a story. Good morning, great leaders. Good morning. How is everyone? I hope everyone is doing well. Why am I not seeing anybody saying hello? Come on, guys. Since when do we do this? How etiquette? Actually, we say good morning. Or is it my phone? But even here it's normally it's real time. I can see the live comments. What's happening, leaders? Good morning. Good morning. We say good morning when we enter class. This is class. Hello, leader Jency Levi. Yes. Where are you from, leadership? So we say good morning. We say hello. And you just say I'm from wherever you are so that we know where you're connecting from. I haven't seen you in live trainings. I love to see new faces in live trainings. So let's please share the link. I'm also doing the same, okay? Let's please share the link. Welcome, Leader Rosari. Let's share the link with our respective partners in the groups, maybe with our prospects. We will start in 2 minutes. Let's just see. Okay. Here is the link of tonight's training. All right, let's share the link. Let's share the link. Let's share the link. Great leaders. Good morning, good morning, good morning, Leader Glenda. Welcome, welcome. Welcome, great leaders. Let's remember to share the link with our respective partners. Um, let's see. I'm also sharing. Welcome, Leader Nzaki. Welcome, Nzaki. My SG Tandeka. Welcome, SGT. Let me just see which other group. Okay. I think this is it. All right. So great leaders. Okay, now we're counting the seconds. We're starting in a couple of seconds. I said we will start now at 10 past. Training on constipation. Okay. So are we ready? I asked for leaders to come with their alkaline backups. Hello? Hello? Yes, you can call the leaders to come in. Good morning, Leader Nelly. Good morning, good morning. Leader Tammy, welcome. Leader Nonsikelelo, welcome, great leader. Leader Mpilo, Leader Mbiana, welcome, great leaders. Let's please remember to share the link. As soon as you come in, you say hi, where you from, and we start with the training. Okay, let me just get out because now I know this thing, it does its own thing. It does magic. Okay, so great leaders, thank you so much for joining me on Nelson Mandela Day. So today we are talking constipation. Has any one of you here ever been constipated? Yeah, even taboo subjects we talk about. No, don't stress. this is health talk, ne? So don't stress. No one will judge you. We will laugh a bit. Laughter is good medicine. It's very good medicine. Laughter. We'll laugh, but we won't judge. Don't stress. Welcome, Dina Tekofato, Dina Monica. Welcome, welcome. Welcome from Namibia. Welcome, welcome, great leader. Thank you for joining us. I think I saw Apostle Daniel somewhere come in. Welcome, Apostle Daniel, Mr. Well. Welcome, welcome. Okay, so great leaders, we are talking about actually a very serious topic here. Ne? I'm a very playful person, but we are talking about a very hectic subject here, constipation. Has anybody ever experienced constipation? I'm asking again. Don't be shy. Do you know somebody that's been affected by constipation? Going once? I know it's a taboo subject, so don't worry. I know you will inbox me. Going twice? Okay, so I see you don't want to share. All right, so great leaders. Okay, I don't blame you, ne? I don't blame you. It's a hectic subject, but I have been affected by constipation in my life. Um, Even recently, I was affected this year. I was affected by constipation, and 2 years ago as well. So I'm number one. Ne? The trainer is saying she has also been affected. Okay, so yeah. So great leaders, as I said, we're talking about constipation, and now what I'm going to do, let me share the screen so that we are all together. Ne? So since we're talking about constipation, this training we should be finished before 8 o'clock. So let me just share the screen. Let's have a look. Let's have a look. Okay, got it. Thank you, Leader Tehufato. Thank you so much, great leader. Let me just say hi. Okay. I'm hoping you can see my screen right now. Where is the screen? Can you see the screen, leaders? Let me see here. Let's go back. Okay, all right. So, great leaders, as I said, we're talking about constipation. Now, first things first, we need to know what is constipation. With any kind of disorder, we need to know. If you come to myself as a product specialist and you say, welcome, leader Kim J, and you say, I have a constipation, I need to first know what is constipation. So, what is it? It's a very common condition. You heard, a common condition. Constipation is a very common condition of the gastrointestinal tract, otherwise known as the GI tract, the part of our body involved in processing and digesting our food. Constipation can affect anyone from newborn babies to the elderly. It occurs when bowel movements are not regular enough and so feces, stools become difficult to pass. Sometimes the rhythmic contractions, otherwise known as peristalsis, of the GI tract are not effective in pushing waste matter out of the system. So there is a need to strain. So, in other words, like this lady. So there is the need to strain. So you put in more effort for number two to come out. Like this lady here. See, she's sweating, ne? She's straining. It's not supposed to be so. I'm just checking. It's not coming on my. Okay. So you strain like Mogel over here. All right. Moving on. So everyone has different bowel habits. Okay. So there isn't a normal pattern. Some people may go twice a week, while others maybe 3 times a day. However, the longer the stools or feces remain in the large intestine, the drier and harder they become, making evacuation more difficult and often painful. I'm saying again, everyone has different bowel habits. So there isn't a normal pattern. Some people may go twice a week, others maybe 3 times a day. However, the longer the stools, the feces remain in the large intestine, the drier and harder they become, making evacuation more difficult and often painful. Most people will suffer from brief, otherwise known as acute episodes of constipation at some stage in their lives without any issues. Some people, though, may be constantly constipated. Now, that is called chronic constipation, with the condition affecting their quality of life. Constipation is often due to a lack of exercise. We're going to go deeper into these, okay? So, constipation, welcome, Dida Moyo. Constipation is often due to a lack of exercise, delaying going to the toilet. So, you can feel that you need to go, but then for some reason you are so busy, you delay it. Okay, so delaying to go to the toilet is also a factor of constipation. Too much caffeine. This is why I so love our cordyceps coffee because it's decaf. Welcome, Sir Richard. Changes in routine or a diet low in dietary fiber or dietary liquids. Medications such as antacids, antidepressants, or even iron supplements can also cause constipation. Welcome, Dida Bolanle. A doctor will diagnose you with constipation if you have had two of the following symptoms for a period of 3 months. Number one, less than 2 bowel movements a week. Welcome, Prof. Mankolo. Having to strain, like Mogel that I just showed earlier, having to strain or push during a bowel movement more than 25% of the time. Number three, a non-complete bowel movement at least 25% of the time. So yes, you are doing number two, but not all the number two comes out. And then the fourth one, having pellet-like or hard stools more than 25% of the time. Now, you get types of constipation, all right? There are two types. It's the acute, which lasts 1 to 3 weeks, and then you get the chronic, which lasts more than 3 weeks. So chronic constipation, let's start with that one. Chronic constipation, this type of constipation is ongoing and can be caused by either medications. Welcome, Dr. Hassani, our latest Diamond 4. Welcome. So constipation can be caused by medications, number one. Number two, by lifestyle factors. For leaders who are always in my trainings, I always talk about lifestyle. Everything always boils down to lifestyle. That's why we have to ask the leading questions. Number three, poor diet. Poor diet choices. So you are eating the kotas, the spatros, the pizzas, the fast food. Yes, the fast food, ready-made food. The 1 minute noodles or 2 minute noodles. Right. Number four, not drinking enough liquids or an underlying medical condition. We're gonna get deeper into these things. All right. Yes, Dr. Asani, welcome, and congratulations on your achievement. And then complications of chronic constipation can include the following. Number one, urinary incontinence. So straining too much weakens pelvic muscles, which can cause a small amount of urine to leak out when either laughing, sneezing, or running. That's urinary incontinence. And then hemorrhoids, otherwise known as piles, which I've trained about, I think, in February. Hemorrhoids, these are swollen blood vessels in the rectum, causing itching, pain, and sometimes bleeding. Welcome, Leader Zozo. And then something called a rectal prolapse. Listen to this. Now, too much straining can cause a part of the rectal lining to protrude from the anus, so it comes out. It shows part of your part of your rectum comes out. Okay, these are complications of chronic constipation. I repeat. And now, 1, 2, 3, 4. The fourth one. One of the complications of chronic constipation are something called fecal incontinence or fecal incontinence. If the bowel is too full, some fecal matter may leak out. Hey, we don't want that, ne? And then the last one, fecal impaction. Fecal matter can build up in the colon. So these are some of the complications of chronic constipation. Welcome, Lida Rita, tuning in from Namibia. Oh, I love Namibia's a lot today. I love it. I love it. I love it. And then acute constipation. This type of constipation usually starts suddenly and is often caused by either travel. I'm one of those people. I'm one of those people that when I visit a place, ne, I can go there for, let's say, maybe a weekend. If I've never been there before in my life, I won't do number two. I'm just like that. Okay. I don't know if there are leaders like that. When you visit a place, you literally, okay, I'm gonna put in a joke name. I feel like I'm leaving my talents when I do number two at another person's place. I want to do number two here at home where, yes, where I'm free. Okay. So acute constipation starts suddenly and is often caused by travel, taking new medications or changes in routine. Or SDT or siyafana danko. Now you need to tell your doctor if you have sudden constipation accompanied by pain, by bleeding, nausea, or lack of appetite, especially if you have a family history of colon cancer. Ah, wow, Lila Rita. We will get to longish products, ne? You will tell us what helped you, ne? A family history of colon cancer, IBS, otherwise known as irritable bowel syndrome, which I've also trained about, bloating, cramping, and change in bowel habits. I repeat, tell your doctor if you have sudden constipation accompanied by pain, bleeding, nausea, or lack of appetite, especially if you have a family history of colon cancer, irritable bowel syndrome, bloating, cramping, and change in bowel habits, or intestinal obstruction, inability to pass wind, vomiting, and nausea. Are we together, leaders? Thank you, Leader Kawana. So we are the same there. I don't want to leave my talents at other people's houses. Eh? Signs and symptoms of constipation, as everyone has different bowel habits, right? Remember that some people they just go twice a week, and then ours they go 2, 3 times a day. Welcome, Coach Z. Welcome, Coach. Now, as everyone has different bowel habits, the symptoms of constipation will differ between individuals depending on their normal toilet routine. I mean, by now, I think all of us know that, okay, at least in a day I go this much, or at least in a week I go that much, that many times to the toilet. Now, if you develop sudden constipation along with pain, along with fever, inability to pass wind, so in other words, fart, F-A-R-T, inability to pass stools, bleeding, severe abdominal pain, unexplained weight loss. I hope you are writing this down there. There's no PDF. Unexplained weight loss or thin pencil like stools. It is recommended you see a doctor pronto. Immediately. Pronto. Immediately, you need to see a doctor. The most common symptoms of constipation are having to stay on the toilet for long periods of time. So it's like you're visiting now. Not 5 minutes in, out. You're there for 15, 20 minutes. Having a distended abdomen, so that means you become bloated, your abdomen becomes big, all right, like 2, 3 times the size. That's a distended abdomen. Loss of appetite and headaches. Hello, am I communicating to someone? Headaches are one of the most common symptoms of constipation. Having bad breath. I've said this before, otherwise known as halitosis. Bad breath is another common symptom of constipation. A furred or coated tongue. All right, so we all know how our tongues are, right? So if you can see that your tongue is now changing, it's metamorphosizing, now it's becoming something that you don't recognize. It has a fur. Aibo. You need to check yourself, ne? So a furred or coated tongue, and then unpleasant taste in the mouth. All of us, everybody, I think we know our bodies. You know how your oral environment should be like day to day. I guess. So when they are just we just how do I say, we put off things that we shouldn't actually be putting off. All right. And then excessive straining to pass hard stools, like that lady that I showed earlier. And then difficult to pass, irregular bowel movements. These are the most common symptoms of constipation. Like this guy here. More guy. Moving on. Now, the causes. There's a lot of them, leaders. Hey, I hope you are writing these down. So, causes. Constipation is often caused by a combination of factors, such as a sedentary lifestyle. So, you're not a person that gyms. More than half of the time, you are sitting or you are just standing. That's a sedentary lifestyle, coupled with a low fiber diet. You are eating white bread, white rice, white everything. There may also be an underlying medical condition. Reasons for constipation can include the following: old age, number one. Constipation is common in the elderly, especially if bedbound or less mobile. Right? Number two, taking certain medications such as strong pain relievers. You must just say 111 if I'm communicating with you. Taking certain medications such as strong pain relievers, antidepressants, anticonvulsants. So anticonvulsants like epileptic medication or iron supplements. If you are on iron supplements, it's also a risk factor. Ne? Dehydration is also one of them. So drinking lots of tea, of coffee, of alcohol, but not water. Hmm? You are busy, you are drinking the tea. Yes, you're drinking the Longreach tea, you're drinking the Longreach coffee. You are okay, the alcohol, no, it's healthy for you. The Longreach alcohol is very good, but not enough water. You still need, nothing can substitute H2O, especially from the alkaline pickup. Nothing. Okay? Taking antacids containing aluminium and calcium, and then some neurological disorders, so brain disorders, such as multiple sclerosis, stroke, or Parkinson's disease. So, ladies and gentlemen, let's say you come across someone, a stroke survivor, and then they tell you that, "Ish, I suffer from constipation or I suffer from piles." Then at least oh, some neurological disorders, such as stroke, are one of the risk factors for constipation. Are we together, leaders? And then what's this phone? Okay, let me just connect to Wi-Fi. Okay, and then some hormone or endocrine disorders such as the diabetes or an underactive thyroid. So you see why, in a sense, our Longreach sanitary wear also helps fighting constipation because it helps the endocrine system. Remember, please note that down. So, some hormone or endocrine disorders such as diabetes and an underactive thyroid or hypothyroidism, it's called, or underactive pituitary gland, hypopituitarism, it's called. Another risk factor for constipation: stress. That 6-letter word stress is everywhere. Ne? Stress is also one of the reasons for constipation. And then depression as well is one of them. And then overuse of some laxative. This can weaken your bowel. The overuse of laxatives. And then another one, eating disorders. Or irritable bowel syndrome or bowel cancer. We are still talking about underlying medical conditions here, all right, that may lead to constipation. And then another one, hey, this one, resisting the urge to defecate. So to do number two, due to pain from conditions such as anal fissure, which is tear in your anus, or bowel obstruction or hemorrhoids, otherwise known as piles. All right. Another reason would be surgery. Any gynecological or abdominal surgery can result in temporary constipation due to pain or fear of splitting sutures and use of codeine-based pain relief medication. Now, I was one of these people here by surgery. This was me when I gave birth 13 years ago to my last born. I had natural birth, and hey, they stitched me right up until the anus. So I didn't do number two until a good 12 days after I gave birth because I was scared, that it will be disaster. And then disrupted routine due to traveling or being unable to eat at regular times, and then eating large amounts of dairy products. So some of you'll find that you actually, when you eat too much dairy, or you'll find that you did not know that you're lactose intolerant. It might be one of the factors giving you constipation. And then lack of muscle tone and healthy nerve supply to abdominal region. Now, the whole colon story and the anus story is all about nerves as well. All right, I'm going to play a video shortly. All right, it's all about your nerves, your muscles. They need to be strong. That's why you need to exercise. That's why you need to exercise. Okay, and then something called rectocele. This can occur in a woman after difficult childbirth, in which the rectum bulges through the weakened rear wall of the vagina whenever the woman strains to pass a stool. Like, do we not have enough problems, ladies? Do we not have enough problems? And then there's a few methods for diagnosis when you go to your doctor. Your doctor will ask questions and do a simple examination if necessary. And always tell your doctor if you experience any bleeding or pain during defecation or passing a bowel movement. All right. Your doctor can do physical examination or a pathological test. The pathological test most is where they take blood test, a stool or urine test, or a thyroid function test. Remember, it's also about an underactive thyroid, can be one of them. And then there's something called diagnostic test. This is performed on people with severe symptoms. All right, the diagnostic test. It's performed on people with severe symptoms or elderly people presenting with sudden onset constipation. All right. For most of these tests, you will need to clear out your bowels before your procedure. Depending on the symptoms that need investigating, the following diagnostic options are available. So, number one, they can do X-ray of the anorectal region, where yes, everything passes by, right? This is me trying to make it nice and simple and comfortable for everyone here. Okay. So, X-ray of the anorectal region. A paste-like substance is inserted into the colon, which is then excreted into a special commode toilet. An X-ray is taken during the process to see if the rectum and sphincter, which is the ring-like muscle of the anus, are working properly. We're checking if the muscle of your anus is working properly. That's one of the diagnostic tests. And then colonoscopy, I think most of us know what it is. Yeah, there's a picture. I won't have to describe, ne? That's a colonoscopy. They put a camera in there, right? And then sigmoidoscopy is similar. It's a similar procedure to a colonoscopy. It is limited to the rectum and sigmoid colon. We will just find out just now what's a sigmoid. All right, it's a part of the colon. And then barium enema. Barium enema has become an uncommon test since colonoscopy is now readily available. It uses a contrasting barium dye and an X-ray scan to detect possible bowel cancer. Great leaders, sorry. Network. Once again. Um, I hope you can see me. I think my phone is a little behind. Can you see me, great leaders? Yeah, network. It kicked me out. Sorry about that. Let's see. Am I back? Am I back? What's happening? Okay, oh, seems like you can see me. Okay, thank goodness. Okay, sorry about that, leaders. The Wi-Fi kicked me out. Okay, so before we were rudely interrupted by network, uh, where were we? Okay, I hope it doesn't kick me out again. Okay, you can see the screen. So I was at the diagnostic procedures, again, diagnostic tests. I spoke about X-ray of the anorectal region, colonoscopy, and there's a nice diagram. We don't need to go into it. And then sigmoidoscopy. Yes, thank you, Pulane. And then sigmoidoscopy, we're gonna get into that just now. And then barium enema. This is where I was. A barium anemia has become an uncommon test since colonoscopy is now readily available. It uses a contrasting barium dye and an X-ray scan to detect possible bowel cancer. Oh no, I was at the last one actually. And then marker or colorectal studies, which involve swallowing a pill containing radioactive compounds. I remember I was there. And then anorectal manometry. This procedure tests whether the anal sphincter, your muscle, is working properly. It's called a sphincter. A small balloon is inserted into the anus via a flexible, narrow tube. The balloon is then inflated and gently pulled backwards to observe the sphincter muscle in action. What's this thing doing now? Okay. Great leaders, I hope you can see this. Okay.
States that the colon is anywhere from 3 to 5 feet in length. Layers of muscle line its wall. The muscle layers are both circular and longitudinal. The muscle contractions produce movement or motility that helps propel the stool through the body. There are 4 main functions of the colon. It absorbs water and salts from the waste. It moves or propels the waste through the colon. It stores waste until it's expelled. Eventually, the waste is evacuated. This is a perfect illustration of what the colon looks like. The colon actually looks like a goalpost. The right-hand side of your colon moves up the right-hand side. It's called the ascending colon. The transverse colon moves across the upper part of the abdominal area. Your descending colon is the left-hand side. It goes out the sigmoid colon and down the rectum. Over here, we have a gentleman that looks like he's just getting out of bed in the morning. We really encourage our patients to stretch before they get out of bed in the morning. That increases the heart rate enough to where that blood flow goes to the stomach, and it helps produce those peristaltic contractions, preparing the colon to have that first evacuation of the day. Another helpful hint we encourage our patients to do is always eat breakfast. We encourage patients to eat breakfast within that first 30 to 45 minutes of getting up. That really stimulates that colon, again, helping us to have those timed, predictable bowel movements. Back over here at the picture of the colon, you can see the small bowel sits right in the middle of the colon. It empties liquid stool stool into the right-hand side of the colon. The colon holds anywhere from 8 to 10 cups of liquid stool in a 24-hour period. The mechanism of the colon is to start pulling that water off of the stool to make it a firm stool. You can see the motility of the colon as it propels that stool up. You have these little peristaltic waves that are always producing movement and increasing the movement of stool through the colon. Up here, same thing. You've got that motility going on. Looking here on the left-hand side of the colon, you can see where that colon is getting really skinny and it's propelling that stool into the rectal vault. This is actually called a mass peristalsis. We have about 6 mass peristalsis per day. It increases when we get up in the morning or after we've had a meal. This actually produces our bowel movement. It pushes that stool into the rectum. Once that stool hits the rectum, we develop an urge. Here we have an illustration of that stool actually sitting in the rectum. Once that stool hits the rectum, the stool distends the rectum, developing our urge, indicating to us that we need to go to the bathroom. Once we get to the bathroom, we are beginning to evacuate our stool. Our sphincter muscles stay completely relaxed and we evacuate our stool. Looking at this gentleman here, it looks like he is in the wrong seated position when having a bowel movement. We really encourage our patients to sit more upright when they have their bowel movement. We also encourage our patients to use a footstool so that they can get their feet up a little bit higher so their knees are higher than their hips. This picture actually shows an excellent position that a patient should be sitting in while they're having their bowel movement. Again, if you'd like to put a footstool under your
Leaders, can you see this video? My side is not playing. I don't know why. Let me do this. Leaders, could you see that video? On my side, it's not playing. I'm telling. Okay, let's resume because it's not finished. Thank you, Osintaki.
feet to get your knees a little bit higher than your hips. That's going to help with that evacuation of the stool. When you're done, we also encourage our patients to use a footstool so that they can get their feet up a little bit higher so their knees are higher. An excellent position that a patient should be sitting in while they're having their bowel movement. Again, if you'd like to put a footstool under your feet to get your knees a little bit higher than your hips, that's going to when you're done with your evacuation, your rectal vault should be completely clear. Your sphincter muscles return back to resting position. This concludes the first 2 videos in our series on constipation. We've gone.
All right, great leaders. Okay, I'm back. As you saw, I hope you saw that whole video, hey, because on my side, I don't know what's happening on my side, but I know there's a network issue. You saw posture matters as well when you go do the number 2. Did you see that? Posture matters as well. You don't slouch when you're doing the number 2. You sit like you're sitting in a chair. I hope you saw that, right? Did you see that? Hello. Leaders, did you see on the video that posture also matters for constipation? Let me go back out here and go back in. Oh, you just see. Oh, I'm so worried. So you saw posture also plays a part. So posture everywhere. It matters everywhere. Don't slouch when you're doing the number two. Sit like a lady or sit like a gentleman if you're a man. So now the other thing, great leaders. I get it. I said, what you call it? What do you say, Ocean? Like you have to sit straight so that you can be comfortable to make to make your thing. Yeah, you need to help it. Um, let's go back to the other training. Let's go back to the other training. Um, share screen. Okay, my screen here keeps on hacking here. I hope you can see my screen right now. Now, prevention of constipation. Let me go to StreamYard here. I know it's live. I'll see if we can see. Okay. All right. So, prevention in most cases, simple lifestyle changes can make a huge difference to constipation symptoms. If there are for constipation, such as a weak pelvic floor muscle, special exercises could be suggested. If diet is the issue, a visit to a dietitian may be recommended. But in general, getting as much exercise as possible, exercise, lifestyle, alongside increasing fluid and fiber intake are good ways to help your bowel function. Are we together, great leaders? Are we together? So number one, diet and lifestyle changes. So you need just to make simple changes in lifestyle that can reduce the occurrence of constipation. Number one, drink more fluids. So obviously the alkaline pickup, the alkaline pickup, drinking water from the alkaline pickup and water from anything else, there's a huge difference. Okay. Now, liquid is absorbed from our stools as they move through the bowels. The longer the stool remains in the system, the less liquid it contains. This can lead to dry, hard to pass stools. Aim to drink 6 to 8 glasses of water each day to avoid this, the hardening of stools, the hardening and drying of stools. Now, eat a whole grain foods to your diet will help ease constipation. Try brown rice instead of white rice, whole meat bread instead of white bread, and snacks such as raisins or prunes. Limit low fiber foods such as your dairy products, cheese, cakes, and processed foods. Now, when we come to the high fiber part, I said drink more liquids. I spoke about the alkaline pickup, and then eat high fiber diet. You can look at the longish teas, all of our teas. You can also look at our NutriV rich pink and blue shake. Right now we're looking at high fiber stuff. I guess eat a high fiber diet. And then another part of high fiber is our supplements, namely our sea buckthorn berry oil and our Astro Sub Reviver. Right, they are part of a high fiber diet. And then exercise regularly. So you can try to get some exercise each day. A daily walk or outdoor activity can be fun and it will help improve a sluggish bowel system. So I've actually undergone some challenge of walking 10,000 steps a day. So what I do, I walk 1 hour in the morning, 1 hour in the evening. So after this training, I'm going to walk for 1 hour around the house to try to get to my 10,000 steps. So what I do, I just put on my earphones and I just dance around the house. So, or outside of the yard. Right, that's another way of exercising. And then allow time for bowel movements. Constantly ignoring the urge to open the bowels can lead to constipation, as the body will eventually learn to ignore the signals. So if you need to do number two, go do number two. Okay, because your body will then learn to ignore the signals, and then we'll have a problem of constipation, which leads to other problems. And then avoid taking too many laxatives, particularly stimulant laxatives. They can weaken the bowel's ability to work properly. Osmotic laxatives are not associated with this side effect. However, it can be easy to become dependent on laxatives, relying on them to cause a bowel movement instead of making lifestyle changes. I get it's easier to actually pop a pill or just take something. I get children should not be given laxatives unless advised by a doctor or a pharmacist. All right. So great leaders. Did you learn something? We are now going to talk about. You can still see me, right? You saying it's hacking? My angel, that I don't know. We must just email Mr. Tucci, way our chairman, to just also give us long reach network seventh and star directors in no time if that's the case. All right, great leaders. So we need longish products for the colon or for constipation. You're looking at the longish teas. Okay. Okay, you can still see me. Okay, on my side, I don't know what's happening. So the longish teas, remember the green tea is known as the constipation tea. And then the green tea is also in the brown tea and in the pink tea. But remember with the pink tea, you can't be underweight and then like you can't be like a coach D here and take pink tea. Because now when you become underweight, you're gonna have other health complications. We don't want that. Okay. Surprisingly enough, cordyceps coffee is actually very good for the colon. It's actually very good for constipation. I'm one of those people. I know when I drink cordyceps coffee, I I just flow. I feel like, am I making sense when I do this? I have that thing when I take the cordyceps coffee. It's a natural laxative, okay? The cordyceps coffee. Obviously, I said the pie cup, the classical alkaline pie cup. Our our shakes, our Nutrivy blue and pink shakes, they've got what? They're high in roughage. I get it. There's over 40 fruits and vegetables in our shakes. And I get it, fruits and vegetables are high in roughage. Okay. And then I did say Afro Sub Reviver and Sea Buckthorn Berry Oil. There's one product that I didn't mention. I actually mentioned it in passing. Which one is it for constipation that I haven't mentioned as yet? There's one product I didn't say. We spoke for choice when we in long reach. As in, me, I don't know. When you're saying you are constipated and you are a member, auntie. You cannot be. I mean, if the teas are not working for you, you go to Cordyceps Coffee and the alkaline pack up. If they're not working for you, go to the Nutrivy shakes, berry oil. Great leaders. Can we have a guess? Which is the one product that I didn't mention that's good for the colon, that's good for constipation? Again, this is training. I don't like a quiet class. How? Are you here, leaders? Hello? Yes, yes. I mean, guessing is trying. There's nothing wrong with guessing. Calcium, good try. But no, not calcium. Not calcium. One last try. Ounces banana. No, I already mentioned berry oil. Okay, let me mention the point. I said all of our teas. I said cordyceps coffee. I said alkaline, classical alkaline pack up. I said our shakes, Nutrivy, I said as well Arthrosap Reviver, also good for constipation and the colon, and I also said berry oil. So I mentioned 1, 2, 3, 4, 5, 6. I said 6 products, and then the tea that I mentioned was yeah, no, my network is bad, leaders. I'm so sorry. Okay, so okay, it's saying I have an unstable internet connection. Okay, my leaders, this is a big problem. It keeps on kicking me out. I'm going to have to hotspot myself again. This is a problem. Sorry about this, leaders. My network is worse than all the other days. Okay, I'm trying to hotspot. Connected. Okay. All right, I'm back. I'm back. Hopefully, it won't disconnect me because every time I use my phone, I have less problems. Can you see me, great leaders? Hello. Let me go out and back in. Okay, thank you, Osnelly. Thank you. Yeah, no, we need to get long reach data, long reach electricity, long reach data. Okay, so great leaders, the last product that's excellent for anything to do with the colon, our vintage health wine. Our vintage health wine. Please remember, it's a health wine and it's potent, 38%. So we drink for health, not drink for pleasure. Maybe you can drink so that you get pleasure because it's also good for libido, but you don't drink like, otlata glass, like half a glass. No, no, 30 to 50 mil, and then you mix it with juice. Now you can mix it with juice, you can mix it with water. Yes, our vintage wine is also excellent for constipation. Yeah. So, ladies and gents, that is all for tonight. Are there any questions? Are there any questions? So, you saw a sedentary lifestyle is one of the causes of constipation. We need to be active. We need to work out. Okay, we need to work out. We need to eat um, eating a good diet, and that also includes or encompasses us supplementing with the long reach teas, with the alkaline pickup, with the berry oils, the arthrosap, any long reach supplement is high in dietary fiber. Even our wine is actually high in dietary fiber. Okay. So, Regina, do you have any questions? Are you enlightened? So, normal constipation, we know what to do now, we know what to do. Oh, the other what I wanted to share, I want to share an easy exercise that you can do if you are suffering from constipation. Okay, you can literally do this in your bedroom. Let me show you the exercise. Okay, I just want to show you the exercise quickly before we end. So this is the exercise you can do at home, in your bedroom, if you're suffering from constipation, if you're having normal period pains. Yes, you can do this, but on an empty stomach. You hold this posture as long as you can. Very good for constipation. I hope you can see this one. Ne? Improves digestion and relieves constipation. This pose. Easy, ne? But remember, you do it on an empty stomach. Ladies and gents, that's all for tonight. Are there any questions? Otherwise, we can call it a night. Are there any questions, great leaders? And remember, posture matters as well. Oh, another fun fact is that healthy fecal matter, healthy feces, right, consists of 75% water and 25% solid matter. Remember, most of the body we are predominantly water, and so is the earth is predominantly water. So at the end of the day, whether we like it or not, we just have to get into the habit of drinking more water. All right. Thank you so much, great leaders. I think that is all. We're still under 1 hour, so we made it. 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 So we have 9 products for this constipation. 9. Ninth one is not for kids. Wine, 38% alcohol. Thank you so much, great leaders. We'll catch up next week.